In contrast to the cervical spine, the thoracic spine is rigidly fixed as the thoracic ribs articulate with the respective transverse processes and sternum. As a result, a lot of force is required to damage the thoracic spine in an otherwise healthy adult. In older adults with osteoporosis or patients with bone disease or metastatic lesions, though, minor trauma might be sufficient to cause a compression fracture. When it comes to its overall structure, the vertebrae of the thoracic spine lie along the posterior aspect of the thorax between the cervical and lumbar vertebrae. There are 12 thoracic vertebrae, each of which become progressively larger from superior to inferior to support the progressive increase in body weight that is placed on each successive vertebra. The thoracic vertebrae are unfused and articulate with adjacent vertebrae via intervertebral discs, forming intervertebral symphysis joints, and articular facets, forming zygoapophyseal joints. The thoracic vertebrae from T5 to T9 have a number of characteristic features. Their vertebral bodies appear heart-shaped and their vertebral foramina circular when viewed from above. The spinous processes of the thoracic vertebrae are short, thick, tapered, and obliquely oriented in the posterior-inferior direction. The transverse processes are long, thin, and have expanded lateral ends. Their superior and inferior articular processes consist of articular facets. The superior articular processes face posteriorly and slightly laterally. The inferior articular processes face anteriorly and slightly medially. Finally, their costal facets articulate with the ribs at costovertebral joints. The T1 thoracic vertebrae has a vertebral foramen and body similar to a cervical vertebra. Its vertical body is more rectangular and its vertebral foramina is triangular rather than circular. T12 then has bony processes and a body size similar to that of a lumbar vertebra. A useful framework when evaluating its anatomy is the three-column scheme that is often used to describe injuries of the thoracic and lumbar spinal columns. The three columns are defined by their location, anterior, middle, and posterior. Much of the ligamentous and muscular structures contained within these columns have been covered during the introductory lecture and when I was discussing the cervical spine. Briefly, the anterior column includes the anterior longitudinal ligament, the annulus fibrosus, and the anterior half of the vertebral body. The middle column consists of the posterior longitudinal ligament, the posterior annulus fibrosus, and the posterior half of the vertebral body. Finally, the posterior column includes the supraspinous and interspinous ligaments, as well as the facet joint capsule. Spinal stability in this three-column scheme is based upon the integrity of two of the three columns. For example, spinal stability may be inferred when plain radiographs demonstrate a loss of 50% of vertebral height or excessive kyphotic angulation around a fracture. However, very few studies have actually been performed to validate this three-column scheme, but in a biomechanical study of cadaveric human spines, researchers found the middle column to be the major determinant of spine stability when axial or flexion stress was applied. In the next section, I'll discuss the anatomy of the lumbar spine.